Hey everybody, there's been a lot in the news lately about safe crack pipes and greater harm reduction efforts and federal funding. And I thought as someone who served in the Obama administration, who has tackled these issues for decades now and has looked at harm reduction and these methods, I want to give a little perspective about my thoughts and I think the thoughts of a lot of folks in the field. There's no doubt that there was a lot of race baiting, partisan hate, and a lot of folks took this and ran with it in really destructive and unhelpful ways. And I certainly don't sign my name with any of those folks. But I think it's important to understand why there was some outrage, especially among people in recovery, among people who have been working on the front lines of prevention and treatment for so long. Harm reduction as a concept started a while ago, decades ago. In fact, it can trace it back to England and certainly back to the HIV epidemic among injection drug users as a way to essentially stop the harm that was coming from sharing needles. And that main harm was HIV. And now, of course, also we're also concerned about hepatitis C. And so programs like needle exchange started and they were controversial for a while, but I think a lot of people came around to the point that if we can not only prevent infectious disease, but also have needle exchanges be a bridge to treatment and a bridge to recovery, then they were worthwhile to do. And I think the research on some of these harm reduction programs being a bridge to recovery is mixed. I think we need to see a lot more on there. But let's set that aside for a minute and go back to this idea of safe crack pipes, because a lot of people say, well, we need safe smoking kits because if people use these products, they can cut themselves and they're using metal cans and they're using things that are not helpful. They're going to get hurt. They're going to get diseases. And so at least this can help them. And while that might be true in some individual circumstances, I think the issue is we have seen harm reduction go from, we're going to help a lot of people with these public health interventions to much more, drug use is not really a big deal and we can do what we want when we want. So it's interesting how harm reduction has gone from sort of public health on the left to really far right libertarian. And so my main issue with something like funding a safe crack pipe is not that I think kids are going to see that and say, oh, I want to smoke crack. Nobody wants to go down that path. And I don't think people are going to see that and it's going to encourage drug use. My issue is that it is taking up valuable time. That policy debate about such a narrow thing is taking up so much time away from greater solutions in this discussion and debate. The idea that a safe crack pipe, or for that matter, even things that I wholeheartedly support like Narcan, if we stop there, the idea that if we do that, that's enough, I think is ludicrous. And we have to understand that there are real solutions to tackle the overdose crisis. And we are wasting so much time, political rhetoric, discussion on these very, very narrow programs, which may or may not work. And we may think is the best thing since sliced bread, or we may think is terrible, but we have diverted our attention away from larger systems-wide solutions that get people into treatment until all treatment is fully funded. I can't imagine why we would fund something like a safe crack pipe kit. We don't have all treatment fully funded. And even in areas where treatment is funded and people aren't going, we don't just stop there. We got to figure out ways to get people into treatment, because addiction, the hallmark of addiction is denial, and it's denial by society and certainly by the individual and family. So we got to think of compassionate ways, not overbearing. We're not going to go the route of some countries that have brought the hammer down, but how can we do this in a way that there's accountability and we can get people who are suffering from the disease of addiction, we can get people the treatment they need rather than just perpetuate their drug use. There is a role for harm reduction interventions as a bridge to recovery, as a bridge to other things to help their life, as a bridge to get them a job, etc. But too often, these programs stop right there at that intervention. We can reverse everybody's overdose tomorrow who overdoses in the world, but we know from data that somewhere between 5 and 20% of those folks will die within the year. That doesn't mean we give up on those folks. That means we need to administer Narcan, but we need to think about what comes after Narcan. And I just use that as one example of a good harm reduction intervention with the reverse overdose. So I think some of the outrage, although some of it comes from very nasty quarters that I don't subscribe to, some of the outrage is understandable, and it comes from a frustrated quarter of people that are saying, we have solutions, we have to fully fund treatment. Public policy is about trade-offs. Every minute we spend on talking about safe and funding safe crack pipes, we're not spending on how do we get that person into treatment. And a lot of people have said, well, that can help get them into treatment. I have seen no evidence of that's the case. I want that to be the case because I don't think we should have a false dichotomy of harm reduction versus treatment. They absolutely should work together. But a lot of the folks sort of praising things like safe crack kits, unfortunately, their goal isn't to get people into recovery and treatment. Their goal is to say, meet people where they're at and let them choose whatever they want to do afterwards. We need to meet people where they're at and not leave them where they're at. That should be the point of any intervention as it pertains to harm reduction. Thanks.